We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the Healthcare Revolution podcast. Today we have with me Sara Wallace, who is a dear friend. I love her so much. She's one of my clinical instructors and led kind of the clinical education for the Veterans Affairs Hospital when I was there as a student. And today we're talking all things training, mentorship. We're really unveiling the curtain of the next generation of healers. Our promise to you today is that you will understand what it takes to train these healthcare providers and all the effort and intention and how that's going to create value for you. So welcome, Sara, to the podcast.
Thank you, Brad. I'm excited to be here.
I'm so excited to have you. We just talked about this, but I remember when I was your student, and I was actually with another clinical instructor, but you had me for the day. And I loved kind of switching between clinical instructors. I had my main clinical instructor, Troy, and I was in the ICU learning all the things, just feeling terrified and afraid I'd pull out a trach or trip over a line or tip over a chest tube. You know, there's so many things I was fearful of. And then I finally got to the point where I was like, I feel comfortable with this. I feel uncomfortable unplugging all these things and moving people down. There was one day I actually forgot to turn on someone's oxygen tank as we were walking, and I almost had a panic, and then I turned it on and we were out of oxygen. And it was one of those moments I'm like, where's my clinical instructor? They're trusting me. What do I do? Right. And luckily we were like maybe 50 feet to the room, which still could have been terrible, but we made it back. No one had any catastrophic events. But I remember one day in particular that you just looked at me in the eye. You were working at your computer, just kind of finishing up some emails, and you turned to me knee to knee and say, we are going to work on transfers, and we are going to make sure you are an absolute expert at doing transfers. And if people don't know what a transfer is, it's pretty much if you have a patient that is dependent or they need help getting out of bed or going from a chair to a chair, they don't have enough strength, how do you help them? But more importantly, help them safely for you and them.
Yeah, body mechanics and trusting them.
Yeah. And I remember like you had me put the gait belt on you. You were my patient, and you just walked me through the steps and helped me problem solve. And you literally went dead limp and said, I'm going to be a dependent patient, meaning you have to max assist or completely lift me 100% of my weight to this other chair. And I want you to feel it, right? Rather than just like described it, you actually had me feel it. And then I kind of struggled through it, right? You're a small gal, but I'm like, man, that was tough. I'm not sure if you made that tough on me or whatever it is, but maybe. Like then I did it, and I kind of epically felt, well, really, I just kind of muscled you over there, right? Like throw you on my shoulder and throw you over. And I got it, right? I did it. But then you're like, let me show you the easier way to do it, right? And I remember you said, put your hands on my butt. And you go around, right? You're on the gait belt, and your hands are really on the hips of the person. And you just got to figure out the balance point. And I like to compare it to, I'm really good at wheeling a motorcycle. I can do it for miles. Yeah. And it's no effort at all. But it's like that tipping point, right? You figure out that, and it's super easy. But if you fall forward, it's a ton of effort. If you fall back, obviously you're falling, right? But once you figure out that tipping point, then it's super, super easy and effortless.
It's all about leverage.
Yeah.
And finding that.
And what I loved about the mentorship you did with me is you took the time. I think we spent like 45 minutes just working on that skill. And, do we have that in healthcare where we spend the time with our students and mentoring them and helping them problem solve rather than just teaching them and say, okay, do it, right? Let's go through the steps. Let's break it down. Let's make sure you feel seen. I remember the way you looked at me in the eye And just the care and concern that you had for me and my success, I'll never forget it. It was only 45 minutes. And then I had small interactions with you, but it was so meaningful to me. So I want to kind of preface it with that. Like, where did your background start in having that deep care for mentoring these students? Now you're the associate director of clinical education at the University of Utah. So you direct all clinical education for doctoral level PT students and their internships, and you make sure that they have safe environments to work at and they're thriving, and you're meeting with them and they're clinical instructors. It's a big job. And you're also associate professor. Am I correct on that?
Yeah, assistant professor in a clinical role. Yes.
That's awesome. So tell me where it all started.
Where it all started. Oh, I love that you share that story, Brad, because I don't remember that day necessarily. So it's kind of neat to hear that impact. So thank you. Where did it all start? I think I for myself have always been very interested in human interaction and connecting with people. As a young person, I saw myself in the healthcare field. It just felt like that was a place to make impact. I was introduced to physical therapy in 8th grade at a career fair. I hadn't heard of it until then. And this provider was really passionate about the work. And I just saw that passion as something that I wanted in my life. And whether they were just a good salesperson or really were passionate about the field, I never know, but it got me here. And I just kind of pursued that path since that time, and then had interactions with physical therapists. I was in a pretty traumatic car accident in high school and was in the ICU for some time, and the physical therapists were the highlight of my day. They took the time to make me feel safe and laugh with me, and made me feel successful in some really, really difficult times. And it solidified that for me. It was like, I can do that. I can connect with people and work through difficult things. And then just watching, and then I sought opportunities to learn from others, right? And then I get into school, and you go out on clinical rotations, and I had clinical instructors, similar, who spend time with you to just be present and really in the classroom as well. In that graduate program, professors who just, again, took time to talk and to really tease through it. And so for me, it was just that human connection and finding these really sometimes intimate ways, connecting with my patients and hearing their stories that really just, I don't know. I love what we do.
That causes me to reflect on different professors and different ways that they handled things. I remember in some courses, I was super stressed to get called out. And then some courses, the way that it was approached made me feel safe.
Yes.
Right? Rather than just called on unexpectedly and like, come perform. It was like, let's make this a teaching situation.
As humans, if we do not feel safe in a situation, we can't contribute. We can't learn. We can't grow. And so in my role as a clinical instructor, or even as a PT with patients, to make people feel safe so that they can contribute what they can to that success, for that relationship. And similarly, I mean, I my first semester of PT school failed an anatomy exam, and the professor at that time, I remember, called me.
I thought you only got perfect scores.
I mean, it was just a trial. But that professor called and said, "Hey, this isn't like you. What's going on? Let's talk about it." And that was just so impactful for me, where I didn't feel shamed. I didn't feel othered. I didn't feel that I didn't belong. It was so impactful, and that I carry just instances like that throughout to help replicate when I can.
Yeah, I had a very similar experience. Did you have Bo Foreman?
Foreman.
Yeah. Bo was very different for me. I think what I love about Bo, he knows the students, because what he said to me when I failed, I was close to failing. And I was actually really good at anatomy. So I took anatomy. It took me 3 times at UVU. It was really hard. Dr. Shively, rest in peace. He passed away. But a lot of people were just really mean to him because he was so hard. I mean, by the time I took it the 3rd time, I got like 104 on the final. Like, everyone hated me because I made the curve go the opposite way. But when I got into grad school, it was very different. It was like, oh man, we're starting all over. But I struggled through those first exams, and Bo just looked at me. He's like, dude, just freaking go to work. Like, stop complaining and just work. And I'm like, that's what I actually needed to hear as a student. It's like, this isn't going to just come to you. Don't just sit passively waiting. Like, it's supposed to be hard. It's supposed to be challenging. He's like, I'm preparing you to be my PT in 20, 30 years.
Yes.
I want you to be the very best in your area, in the state, in the nation, right?
Yes.
I'm preparing the next healthcare providers. And if I just let you just ease through this, you're not going to be a great therapist, right? You're not going to go out and create great things and make good decisions. And I need you to be the very best, and we will demand the very best out of you. So go to work.
Just get it done. And I think the other thing, Bo has spoken to this, and I feel it. And now in my new role in academia, I think we see our students come and they want to be the best. They want to prove themselves. They want that 104%. And that's all fine and good. And that got our students to where they are. To get into a graduate program for physical therapy is not easy. But I think the thing that I'm working on with students now in this side is to help them let go of that. We're no longer competing, that perfectionism. And there's so much to support that it's really present, specifically in physical therapy students, this perfectionism, and helping them to let go of their identity with a grade. Mm-hmm. We want them to know the material and to be able to think through it and move through it without that weight of what the outcome is.
Rather than just memorizing, we want you to be problem solvers and to be able to use the stuff that you should know that should just be ingrained, right? Whether it's muscles, nerves, systems, whatever it is. But how can you take that and apply it to a complex issue and actually problem solve through it, right?
Problem solve through it,
because if you teach people to just be memorizers, they're just memorizing task to task, and they're memorizing and then dumping.
Yes.
But if you teach people to be problem solvers and intuitive thinkers, they actually go out in the world and solve problems.
And then when we're met with the very individual humans that we seek out to serve, who bring with them all of their life's demands and complexities, then they can problem solve through that, rather than, your paper patient of low back pain and, this is what we're going to treat and this is what works here. But we need to bring that problem solving and all of that information from our didactic teaching, our school, our classroom teaching, to that situation for that problem solving and just meeting and working through that.
Yeah, we're talking about the next generation of healers here.
Yes.
And these students that are coming up. And I'm seeing a really interesting shift. And I'm wondering if you're seeing the same thing. These next generation of healers that are being trained up are some of the best that I have personally ever seen. Tell me about what you're seeing in the classroom and clinical education.
I agree with you. The students, and kind of what drew me from the clinic to the classroom was just wanting to have more time with students and more, I don't know, more hands-on with them and to see how their brains work. I was getting these glimpses in the clinic of just how students were learning these days, what our programs were teaching. But you're right. There was a student, I think my first semester teaching, which was just a couple years ago, and I was just sharing a story about how I'm not a morning person, and my work demands were, well, I have to get to work at 7. And the student raised his hand and he said, well, I wouldn't do that. I would find another setting. And I remember thinking, well, gosh, I would never even consider asking that question, right? So to your point, I mean, our learners today are challenging kind of the status quo. And some of us can see that as resistance, or kids these days, or whatever it may be. But I truly believe that the people in my classroom today are just going to make such change in this profession.
And how is it different?
It is different because they are challenging the status quo. I think we're looking at more involvement in life. We're seeing these learners really striving for that work-life balance that I don't know that prior generations have really striven for in the way that we're seeing now. And I think there's pros and cons there. There's some working through how that melds itself with everyone we've got in the workforce these days. But they're looking at ways to make even nuance better, right? We're seeing more specialties coming in. I'm seeing more advancements in pelvic health and POTS and all of these, Ehlers-Danlos, all of these diagnoses that have been in the realm. And we have people exploring, but we're having more people interested and more people asking in-depth questions.
They're more curious.
Brad, you bring up
and
one of my favorite words.
Curiosity brings so much trust and understanding. And when people are curious, it shows interest. And when people are curious that they're going to pay attention and they're intrinsically motivated because there's some fire within their heart that's saying, I want to chase that. And older generation may interpret that as you're being challenging, right? Like, oh, you're challenging what I'm saying, or you're suppressing me as a professor. But ultimately, when I hear someone that's curious, they really just want to know. They're seeking to understand. And if we're not open to that and we're not curious about why they're curious, then it kind of closes the door on them. Yeah, healthcare is changing so much, and there's different demands than there ever has been. And I believe we have the next generation, the best generation of healthcare healers as students in this upcoming generation that are going to make a tremendous difference.
I do too. I think it brings to, in my class, we talk about, there's always been patient-centered care. And I think any of us working in healthcare, really, that's at our core. I mean, we're not here for ourselves necessarily. We're here to help others. But a movement we're seeing in research and in medicine is really person-directed care. And the difference there, it can be very subtle, but if we look at patient-centered care as kind of working on improving function within a patient, right? You have a patient come to you with an ailment, and we're going to improve that so you can, knee pain, and then we're going to help so you function better. You can walk
kneel and
better,
play with your grandkids,
yeah.
It's very specific to what they want.
But if we start to move into person-directed, okay, it's obvious they want their knee to feel better. But why is that important to them? Mm-hmm. And you brought up good points, to kneel, to play with their grandchildren. It's less of a function based and more of to promote a meaningful life.
Yeah, and you mean like PTs, we would focus on, we got to get to 120 degrees of knee flexion. That is the goal. But now the shift is, you want to be able to play with your grandkids. In order to do that, you're going to need around 90 to 120 degrees of knee flexion.
Yes.
Do you see how that's going to connect you and why bending that knee is really important? Right? That's a huge shift because people understand why they're doing that, and therapists understand why they're doing it too. So it's intrinsically motivating, and it's literally the driver and the engine for accomplishing what the patient wants. And it's so much more meaningful for the therapist, because instead of saying, I got that patient 120 degrees of knee flexion, they're saying, I got that patient to be able to kneel, to be able to play with their grandkids for the first time.
Yes.
Right?
That connection, as you say, that, really our physical therapists and our students in the classroom today, just really getting at those questions of why are you here? Why did you come to me today with this problem? You tell me it's been going on for some time, but why today? Why now? Right? Really getting at what is salient or what is necessary for that patient to have success in their life. And I think the really neat thing is our students are taking that into their own lives too, right? They're really committing to their time at work. They're really connecting with those around them, but they're taking that same curiosity, that same interest and passion into their lives. They're working on ways to find that work-life balance. We see, oh my gosh, the students are so involved with rock climbing and running and just promoting overall fitness and health, and they're walking the walk, and they're bringing that into their clinics, and we're seeing more specialty clinics so that the elite rock climber has a place to go where those therapists are going to understand
the language, the background, to be able to talk the talk, right? Like I do that activity as well. Let me show you how that's done. Let me show you how to progress that. I know what that feels like when you have that specific injury. What makes me the PT that I am, I was going to say the best PT. What makes me my best version of being a PT is that I've had so many injuries that I can deeply empathize with the patient. I'm like, I know what it's like to not have availability to use my hands. I know what it's like to be in a cast. I know what it's like to be on a sling or crutches or a wheelchair. Like I feel that.
Yes.
Right.
And I think that is what has drawn a lot of us to the profession, where we've been through those things and we can relate and identify. I think the really unique thing that I'm seeing more, and I've seen when I was in the clinic and saw students and now in the classroom, is even if we've not had those experiences as a human, I've not had those experiences, but
hang out with me and we'll make them happen.
I know. I I don't need that right now. But just the ability for students and practitioners to connect, even if they can't relate, there's that empathy because of the questions, because of the engagement we're getting in those patient sessions. So you don't have to experience the same injury. Or even have had injury yourself. You might just come to the profession as seeing hope for the, optimizing human potential kind of thing. But our students are really exploring those interpersonal, that nuance, those connections that help drive the outcomes.
Yeah, absolutely. I love that. Tell us why this matters for the patient, right? There's so much that's happening behind the scenes. I mean, I think about all of my professors at the University of Utah, and even before the doctoral program, like my undergrad, like there's so much that's done in mentorship and hand-holding, right? And pushing out and, essentially like throwing in the water, like tossing you into the deep end, right? Like there's steps to this. Yes. And there's so much energy and time and effort and intention to what all of you do. Why does that matter for the patient?
You bring really, I call it, we're like shoving them from the nest, when they go out into clinical or leave the classroom setting, but they've flown away. It matters because you shared a story and it was not uncomfortable for me to hear, but I think we just move through our profession and move through clinical instruction as part of our job, right? We don't necessarily think about the impact we have on others. But when you share that story, or when I watch other people have interactions with their instructors or with a professor, it's so meaningful. So for myself, being in the academic setting, I care about my students. I'm 10 months into this role, and I'm now sleeping through the night, right? Like I'm now not laying awake in the middle of the night worried about, these 5 students. But for me, they're
almost like children to you.
They are. My mama heart, I just want to, and when they have successes, I just want to share that with them. And when they have difficulties or failures or hardships in their life, I want to be there for them to the degree that is professional and that they'll allow. But we're all in this together, right? I think 3 years of grad school and there's a lot of growth personally, professionally, and individually. And we're going to be witness to some really difficult things. And so, to get to your question, I really think in the classroom, and I really felt it as a graduate of the U program as well, just feeling like a family a little bit. And everyone has different comfort levels with that, but the warmth that the professors have and the degree of like pride in the profession and in the program is really there. And there's so much prep work for even a 1 hour lecture or a 2 hour lecture. I had no idea. I think, looking back, I'm like, oh, this was a lot, but just really helping to make the information digestible and engaging. There's a number of things we have to teach because our accrediting body requires it of us. And we want our learners, they need to have that out into the field. And students might not feel that is most important at that time. But trying to make that, just trying to share that we care.
Yeah.
Right. And to hopefully model that curiosity, model that interest and that warmth so that they can take that with them.
Yeah. And it makes me think of the class that you actually participate in now. I think, I'm not sure if I can speak for everyone here, but I think the majority of PT students feel like teaching and learning the course is a waste of time.
Yeah.
Now that I've been in practice, keep in mind, I have my undergrad is in communication and leadership studies. So I studied a ton of that, like behavioral change and communication and connection was my thing. But there was no class that helped me more. Obviously, the anatomy and the clinical stuff is extremely important.
Yes.
But 70 to 80% of what we do is just connection and listening and communication. You have to know the clinical stuff. That's just like non-negotiable. You have to be able to problem solve through complex issues. But the majority of what we do is human connection. And that class taught me more how to be an empathetic and a connected clinician than any other course in school. And, that's probably the class that gets the most amount of complaints. Maybe that's why you and Amy are over it, and Reva, because you kind of absorb negative feedback. But I hope more than anything that as students go through these programs that they truly seek to understand, why is it I'm taking this course? Not as just a checkbox, but what can I actually take and use? Why does this actually matter? If you were to compare anatomy course to teaching and learning, how much effort are you going to put into one versus the other, right? Why does teaching and learning matter? Because that's what you do 90% of the day. Teaching and helping people learn, right? Yes. And behavioral change. Anatomy is important and mastering those skills is important. But each class, each course, each clinical education has its specific role in helping develop yourself. I think about the early days I was with Troy and Tom, and we were in the ICU, and there was a guy a veteran. He was around 300 pounds, just big dude, and he wasn't just like overweight. He was just muscle, just huge guy. And he was at his last couple days before he passed away. And this was my first death that I had dealt with as a student, and it impacted me a ton. And I remember we were working with him, and every day we would get him from the bed to the chair, and he was max assist times 5, right?
Yeah.
And we had done the transfer 2 or 3 times. And I remember Troy and Tom were both helping me, and they said, okay, we want you to lead the medical team, the nurses, all the staff, and you're in charge. And I want you to get him from the bed to the chair. Keep in mind, he's a max assist, right? This is a 300 plus pound dude. And I am going to use the skills that Sarah taught me. That's in my head. I'm like, Sarah she'd be proud of me through this, right? And then Tom and teaching me how to manage all the equipment. And there were so many lines. I remember there was in my mind as a young student, there was 50 lines. And I'm probably not exaggerating, right?
No.
He was tragged. He was on multiple chest tubes, IV lines. It was literally like a complex, a Rubik's Cube. And you had to think about 15 steps. Because you had to think about, okay, I got to go from here to here, from here to here. The equipment has to be here. If I trip over that line, literally, it's a big deal, right? I'm not saying you could kill them, but you could kill them, right? And obviously you have nursing there to help. But this is a whole team of people that come in. It takes about 4 or 5 people to move all this equipment. But you have to, as a PT, you have to instruct them.
Yes.
Okay, I'm going to move here to here. We're going to do multiple steps. I need you here, right? But I felt like such a freaking bad A.
Yeah.
When I did it. Yeah. And it was the mentorship. It was the steps. It was the step from when you took me and showed me how to do a transfer. And I want to say hundreds of hours. I'd be over-exaggerating. Tens of, maybe 100 hours that Troy had spent with me of helping me move equipment and making sure I truly understand. I remember Troy one time, he looked at me, he's like, Brad, you're very charismatic. And I love that about you. He said, just make sure you know it.
Oh.
He said, because sometimes you can fake it, but I really want you to know it.
Oh.
And that really impacted me because I said, you're right. You're totally right. You're right. Sometimes I kind of just get away with my charisma, right? And that was powerful for me to hear because he knew it. He could see it. And he really cared about me and he wanted me to succeed.
Yes.
And he said, you just got to know it. I need you to know it. And I got to feel it, right? And that really made me double down on my efforts to truly know the clinical decision making to move from step to step. But I just felt so empowered. And so, like, all the nurses were just looking at me like, great job. Everyone was giving me a high five. And he ended up passing away a few days later, and it hit me hard. And Tom and Troy worked with me a lot. And, you know, it was little conversations. It wasn't like we had a whole therapy session for an hour. It was just, you know, quick 2 minutes here. How you doing? You know, that's hard.
Yeah.
You know, this is just part of what we do. And, you know, these are some tips that I've learned over the years. And thing is, what would you say to the clinical instructors that just feel like that they just don't have time to do this? Like, I just remember so many things that you guys did that it didn't take a lot of time, but it really mattered.
I love that story, and knowing Tom and Troy very well, I can see all. I mean, I just got such a visual of all of you in that room, and the warmth that those two share in their care very differently, right? And you got to experience that. I think as clinical instructors in each facility is going to be so different, whether you're required to have a student because of X number of reasons, right? You're a teaching hospital or it's part of your contract or whatever it may be. But I mean, I like to come back to what drew me to the profession, right? That human connection and that warmth. And if we kind of look at the APTA, the core values, you've got advocacy in there and really just trying to give back to the profession. And each one of us moved through a graduate program having to spend time in a clinic with another provider. And we all had experiences with CIs that were either really positive and helped mold us or maybe negatively. But we learned from that and we grew from that. So for those instructors that are having difficulty finding time to provide those mentorship or those snippets of warmth, I think I would argue that a lot of them are probably doing it without them realizing, right? Students are always watching, just like our children.
Mm-hmm.
Oh my gosh, the things that they pay attention to, I don't even know about. But our students are always watching. So even if Tom and Troy hadn't checked on you as a person, you probably saw their warmth in care of that patient, right? And you probably took that with you. And then you felt it on a personal level when they checked on you as an individual. And I think we can do those things very simply. And we do it with our patients. They walk in and you greet them with a smile and ask how their drive-in was or how they're enjoying, you know, the season. Those quick moments of connection really help, whether it's a student or a patient or a coworker. It doesn't have to be a sit down heart-to-heart therapy session because that's uncomfortable for a lot of people. Mm-hmm. I'm all for it. But just those quick moments of how you doing? You know, there were a number of times when I worked with Tom and he didn't quite have the capacity or it felt that a student maybe didn't want to talk with him. So he'd ask me, like, do you have the space? Can you check on that student? I think they'd connect with you.
Yeah.
You know, and just finding the strengths in your clinic or in your team.
Yeah. And I loved what the VA team did for clinical education while I was there. You guys would meet weekly. Mm-hmm. It seemed like maybe it was every other week. I don't know, but you would kind of have your individual meeting. I don't know what was discussed there, but it was really meaningful because I know that you guys were constantly thinking about us individually. Like, okay, if I was putting myself in that room, I bet, and maybe you can correct me, that you would have a moment in which you said what students are struggling, what are their strengths, what can we do to challenge them more, what can we do to support them more, And how can we work together as a collective team to make that is that what happened in these meetings?
Yes, every Thursday. So we did it every week.
And you guys, how many students did you take on a regular basis?
We had probably 20 to 25 a year.
Yeah, I mean, it's incredible how
so
many
4 or
students
5
you
at
take
a
on.
time, 3 to 5.
I'm sure it's exhausting at times. Like you send your baby away and then you get a new baby.
Yeah,
and you got to start all over.
Here's the bathroom. Yep, here's how you log in. It can be, but again, for myself, just like a patient, you just think, well, this is their first experience here. I can't expect them to know this, but we met every Thursday, and we would all come to the meeting, and we would, it was staff meeting as well, but we made time for the students right at the onset. And so each of us who had our own student, we would talk, I was as site coordinator had a list. Here's the students we're discussing. And, we would talk about what they're doing well, areas of growth, because as you shared, we got to work with different students on different day, areas of growth, areas of attention, or just a few things that maybe need tweaking, or goals that the student has, or... It
just seems like you guys were always aligned, because I went from Troy to Tom to Nikki to you, like everyone kind of...
Yes.
Bart, like everyone seemed like they were pushing for the same challenge with me. It's like, okay, you've mastered that, now to the next.
We did. So we would meet as a team, and as a team, we really kind of came to a discussion, but as a site coordinator, I would kind of wrap it up, be like, okay, Brad this week is doing really well here. We're going to work on, timeliness with notes. Brad really wants exposure.
I'm sure
I didn't remember that.
Brad's still terrible with notes. It
they're
hasn't
the
changed.
worst part of our job. But that just kind of wrap it up, or like, and there were times where students would share really intimate parts of their life that they were struggling through. Oh my gosh, the things, because life doesn't stop when a student is in clinic or in a classroom. There's divorce, there's cancer diagnoses, there's sudden deaths, there's illness, there's mental health issues. It's all there. Yeah. And students, I think when we see them in clinic, they have a sense of obligation to be there. Out of right, we're just going to plug through, we're going to get through this graduate program, we're going to do it. But we all know if we don't bring our full sense of self, if we're not present and we're not taking care of ourselves, then we can't take care of others. And I think our team was really good at we had such a big team and just a breadth of personality styles, right? And so students would connect with us all kind of differently. And we tried to make it, hey, like, I'm busy, or we're all busy, but if we're not giving you what you need, let us know. Yeah. We tried to really promote that. But even in those meetings too, if there was a student going through something really difficult, the details weren't shared. It was just like, hey, Brad needs a little more space this
gossip,
week.
It was purely how to help.
Yeah. Brad needs space this week, moving through some things. So you're going to see us working with less patients. And that's something we're doing as an instructor and student.
Can you guys help us in order to do that, right? Everyone would jump in. Okay, I'll see a few more patients today throughout the week, whatever.
Yeah, just as we would with any of our team members, right? We if we are training our PT students to be PTs in the field and work as a team, we should model that.
Oh, so beautiful.
Humanity.
I remember one morning, it was super early, like 6:45 a.m. And Nikki and Tom were just like singing at the top of their lungs this song.
It's probably Friday.
As this like dynamic duo. I'm like, this is legit. Like, this is a remarkable team. If I would have got a job at the VA, like right out of school, I probably never would have started my own practice. Like, I loved that team so much because you guys all worked together so seamlessly and you all supported each other. I remember on Fridays, we were playing spike ball at noon for a half hour. It was like, quick, get back to work, right? Because we got to get all of our caseload done, because if we work together as a team, we can go home.
Yeah.
Right? And the quicker we get it done, the better, or quicker we go home, right? But everyone would participate. Like, literally the people that wouldn't even see patients on the ICU would jump in to see patients on the ICU.
What do they call it? No Heroes Friday? Like,
yeah, it was so incredible. Like, everyone was just willing to work together. But I want to shift our conversation just a
Yes.
little bit here. Let's tie it back to the patient. How is the patient, what is their role in helping these students develop? I have two stories I want to share to kind of set the stage
Yes,
for this.
please.
I remember being with Nikki, and it was the first time she kind of just trusted me to go on my own. I had no idea she was right outside the door. She was really good. So talented. Love her. But I went in, and in my mind, I understood that every patient that had balance issues or heart conditions needed to be in a gait belt. A gait belt is just a belt that wraps around them, so if they collapse or fall, you can catch them, right? So I was working with a female patient, and we were getting her up. She was in, what was it called? Tele floor. Like they were monitoring her
Cardiac.
heart, right? On the cardiac floor. It's been too many years now.
I know, right?
I've forgotten. But she got up and she's like, I'm not putting that gait belt on. I'm like, I'm required to, as part of, being a physical therapist, I'm required to put it on. And she doubled down. She's like, I'm not putting that on. And I went to say one more word, and then Nikki stepped in the door and she said, she doesn't need to put it on. But I was like going to push a little bit more. I'm like, I'm literally required. Like I'll fail,
Yeah.
right? If I let you go out and you collapse and hit your head, right? All these things are going through my head as a student. And then it was such a great teaching moment. And I'm so glad that patient actually stood up for themselves, because Nikki pulled me aside afterwards and says, female veterans, most of them have been controlled by a male their whole career. They don't want to be told what to do. And just keep that in mind as you work with this population of people. It was such a great teaching moment. Yeah. Another one, I was with Tom on the ICU. And this guy was there for like 6 months. And he was on a ventilator, or not on a ventilator, on the machine that's running their heart. What's that called? They have to carry it around. Not on ECMO. Essentially, like, he's on his deathbed.
Apparently,
right?
I've been gone too long. I can't remember either.
It's been a minute for both of us. But essentially, the machine's running his heart, and he has to carry it. I had to unplug it, plug it back in on the little battery pack, and we'd walk around. Tom would be LVAD, yes, he was on an LVAD. And this patient I got pretty close to, and the first day I went to unplug his breathing tube and plug it in somewhere else, and he screamed at me. It was like my first day.
Oh my gosh.
That's what he did. And I'm like, He was just trying to make me nervous.
Oh, did it work?
Yeah, it worked. I was so stressed because it was the first time I had unplugged one. I'm like, right? Did I just kill him? What happened? Right? And because there's multiple steps with him, and there's some serious things that could happen if you unplug something too soon or didn't plug something back in.
There's a proper order,
right? And there's a sequence to what you do. But long story short, he was having a really bad day. And I came in, and I'm Mr. Smiley, Mr. Happy, Mr. Go Lucky, 7:30 a.m. I'm like, all right, let's go for a walk. All right, we're getting after it. I'm more independent at this time. Tom's out in the hall, just kind of supervising from a distance. And this patient screams at the top of their lungs and says, I don't want to see your beep beeping face. Get the beep beeping out of here and never come back. You're a worthless piece of crap student, right? And that shook me. And I don't get shook easily, right? I was just like, what just happened?
Yeah.
And I pushed a little bit, and I said, I'm sorry if you're having a bad day. I'm just here to help. And then there was more altercations happening, right? Then Tom steps in and just says, hey, we'll see you later. Walked out. Tom didn't know this, but later the day, I overheard a conversation with him and the patient. And I was kind of standing out the door. Tom didn't know I was there. And I just wanted to hear like how he was going to respond to this. And Tom just said to the patient, this is a student that's learning. That's no way to treat anyone. I get that you're struggling, you're having a hard time, but please don't treat people that way. We're here to help you. That student is here trying to help you. And it's not a way to treat people. And I'd appreciate if you treated him better. And as a student, I was like, my boy, Tom, thank you for having my back, right? It was so meaningful. And you talk about like watching people. Like I learned more in my clinical education through watching and observing than anything else. Like people demonstrating things, people demonstrating how to talk to people. It's super important. But I'm curious, what would you say to the patient is their role in helping the student learn?
Oh,
And giving them
excellent.
opportunities to learn. Because so many patients are like, oh, I don't want to work with a student, right? And I don't know what percentage, but what advice would you give to the patient on working with students and how that can create value for them too?
That's an excellent question, and I think here in the Salt Lake Valley and in Utah, with so many of our teaching hospitals, I think our patients are just kind of used to there always being a learner, right? We go and there's resident doctors and different, but so they're kind of invited to that. It's somewhat normalized, I think, in a society with teaching hospitals. But I think what I've seen our patients do with students and their role, they do give a little pushback. I think sometimes patients think, well, maybe they know more than the student does, and it's their job then, the patient's job then, to really challenge them and make it as hard as it's ever going to be. I don't see that too often, but it does happen. But I do think I want to remind our patients that when there is a student, when there is a student PT or even a resident surgeon or a resident physician, we really should be inviting our patients into that conversation, back to that person-directed care. That patient really should be dictating what happens. So
They're in the driver's seat. Yeah.
they're in the driver's seat. So to the story you shared with Nikki and that patient who was like, I'm not wearing that belt, right? It's our job as a provider to provide reasons of why that belt has been indicated.
Yeah.
Why it's important for their certain scenario. But then with a patient with sound mind can decide whether
Find that.
that's justified or not.
Yeah.
And
We're
we
here
need
to be a guide,
okay.
not a dictator.
Yes. We need to be okay with that. And so our patients need to remember that whether it's a student or a provider, that they have rights to share if something feels right, if it feels uncomfortable. They don't have to be people pleasing in that situation. Our students learn so much when our patients share, hey, you did that. You kind of moved my shoulder today, and that felt really good. I really liked that. When Brad did it last week, it felt a little different. But the way you did it today really helped me.
Yeah.
Or conversely, hey, you spent time on my shoulder today, and Brad did it last week, and I liked the way Brad's hands, I liked how Brad did it better. Maybe you could talk with him, and it's okay.
Yeah.
We really want our patients sharing that because we want our patients leaving the session feeling that they were cared
sometimes
for.
Patients they feel timid, or
Yes.
they don't want to step on toes or feel like they're mentoring the student, right? But ultimately, we need the patients to help with the mentorship.
Yes.
This is part of it. We need feedback from you to give to the patient, because if my student is working with you and you feel like they're doing a terrible job, the form in which I'm seeing them do something on your shoulder looks really good from a distance, right? But it might feel completely different. But if you're not giving that good feedback as we go, it's hard for us to really truly mentor that student. It might take away from an opportunity for them to learn.
Yes. Right. And also, if we aren't providing that as a patient, we're not providing that feedback, then we leave that interaction feeling,
I got less value care.
I get less value care.
Because they're teaching a student, right?
Yeah. And then clinic outcomes aren't great, right? If a patient leaves thinking, well, they're just always going to have a student and I can't get
better. I can't get the care that I need because they're too busy mentoring the student, right?
Yeah. And that is not at all why we have students in clinic. It's really to help drive optimal care within this valley and within the profession. And
when I have a student, I am actually such a better clinician.
Yes.
Because they're bringing in things, they're watching me, right? So I'm on the top of my game. I'm always on the top of my game.
I know you are.
But I'm like doubled down on top of my game when I'm with a student, because I really want to show them the walk, right? Like,
yes.
I think about my mentors and what they did for me, and I really want to deliver an exceptional experience for them. And it makes me better. And they'll bring in research that they just studied, that's fresh, that's new, that I haven't looked at a research article in a couple of years.
Exactly.
You know what I mean? Like in that specific area, like my interest in different expertise have changed and I'm reading different things now than I did at that level. And when they bring that to the table, it's like, that's a good refresher. That's great to know where things have adapted in science.
Well, and so many times we get into practice or in life and you just start doing things out of sheer memorization or laziness or habit. But if a student or someone challenges that, just, can you explain to me why this happened? Then you have to really think through it to that point. And so our patients can be really involved in that. And I think as clinical instructors, even inviting that, inviting the patients into their care. Say, hey, I've got the student with me and I filled them in on what we've been working on. And I know we worked on this today. They're going to practice that. And your feedback would be really appreciated.
For sure.
Let us know how you feel about that.
It's so important for the patients to understand that their role in that, and that we actually want to invite them in. And you're a part of this teaching process as well. And you should walk away with better care when you have a student than diminished care.
Yes.
Right. It should improve the patient experience, not take away from the patient experience. But it is important how clinical instructors implement that. And that as clinical instructors, we're asking the right questions. We're asking the patient to be involved, because sometimes the patient doesn't know, or they might feel that they don't have a place. But it's important we all work together as a team. And that's really what the healthcare revolution is about, is making sure we're getting customized care for the individual needs of the patient. And all of us are collectively working together with the patient involved. The patient's in the driver's seat. We're all in the passenger seats or in the back seat, and they get to choose who's navigating them. Like, who's giving them directions, and we're all there just to be a guide, not a dictator, and to help them along their journey and back to what they want, not what we want.
Yes. I think I often, use patients and students kind of interchangeably in the way I think about things, but you bring up really great points, the healthcare revolution. I love that. But just the driver's seat, our patients are learned consumers these days. They have a wealth of knowledge at their fingertips all the time with social media. And they can find journal articles. And if they're savvy enough, they're going to process through that. And they're going to come to us kind of with questions, and they're going to be engaged. But by the time they've come to our clinic and they've asked for our help, they're really looking for us to kind of parcel it out and almost like cater their session to them. And our students are similar. They have the world at their fingertips, and they always have. These learners were born with cell phones in their hands almost. And so, back to our discussion earlier about that curiosity and being able to ask questions that are learned and engaging, that aren't challenging, that aren't to disrupt what has been established before them, but just really to incorporate information into what they're going to provide to their patients.
Yeah, I love it.
It's just so important to recognize that when we get a patient and or a student in front of us, right, that they have a wealth of knowledge, and they
have things to bring to the table.
They do.
So much value.
We need to just provide space for that. And I think there comes a lot of vulnerability in that, right? And just recognizing our own weaknesses or our own areas of attention that we need to grow in, and just being okay with providing that open space, that we don't need to be the dictator.
I love it. As we wrap up the podcast, this has been such a good conversation. I want to give advice to really 3 different people.
Okay.
What would be your advice to patients, if we were to summarize this? What would be your advice to the student? And then what would be your advice to the clinical instructor on how do we create the best environments for all 3 populations?
I think for all together, we can get very simple, and just to advocate for yourself and be curious, ask questions. For the patient, I think reminding patients, especially with different generations, that you really are at the forefront of everything we do, every decision that we make. And if that isn't apparent to you, then we've missed the mark that day. So ask questions.
Sarah, I love that so much. Like, the patient is at the forefront of everything that we do in clinical education.
It is.
That is powerful.
Yeah. It really is. And so if we're not making that present, like, you don't leave a session feeling that way, then then help us understand that we missed the mark for you,
And
because we want to
advocate for
do better.
yourself, yeah.
Advocate for yourself. We're open to that. I think as PTs, we are constant learners. And so we seek feedback. And if we're not seeking it from you, it's because we just forgot. But you are at the forefront of everything we do,
Yeah.
our patients, and reminding our students of that. I think sometimes students leave a classroom and come to clinic, and there is that shift, right? Where in the classroom, they're working on a grade or an outcome. And we want them to take that information and parcel it out to their patients, and reminding our students the patient is the reason we're here. They know that in their heart, but I think our students in a clinic often feel everything they do is being judged, right?
Yeah.
What they wore, what
It's the
they
nature of
said,
school, right?
how they stood, if they knew that answer or not. But if they keep
Where do I put my hands? What
do I do with
all
these?
the things, like, what's my face saying? You know, like, there's just so many things that they
it's
worry
so
about.
stressful. But if students can remember that the patient is why they're here, and if everything they do is kind of in the patient's best interest, then the rest will sort itself out. And then for clinical instructors, recognizing those power dynamics between all parties at play, right? You've got a clinical instructor who is, the puppet master.
Mm-hmm.
You do get to kind of,
You're the facilitator of this.
you set the tone for everything.
Yeah.
So in the end, it kind of comes to you. If that patient leaves not feeling cared for or having the best experience, then you probably facilitated that in some way. So it's your job as a clinical instructor to provide an open environment so our students feel comfortable asking questions and engaging with their full selves to provide the best care for your patient.
I love that. Sarah,
Yeah.
Thank you so much for your time and sharing that expertise. I love, and I just want to finish with this. Everything we do is with the patient in mind. Like, the reason your job exists is for the patient in mind, right? The reason why we put so much heart, intention, and thought and effort into all of this from all the parties is for you as the patient.
It is.
And we want every patient to know that there's so much effort, intention, and heart and passion that goes into this. And I'm so grateful for people like you that stay in those systems through the hard feedback, through the toughness, through the challenge, through all the negative things that happened, and you still stay, and you still give, and you give with kindness and love and connection and just so much heart. And I'm just so grateful for every single professor that has done this for decades and years and just put so much energy and soul into it. It's so meaningful, and you're really raising the next generation of healthcare healers. So thank you for what you do.
Yeah, I love it. You're welcome.